WBUR Podcast, Boston.
This is Up Next. I'm Deborah Becker. The warm weather always brings with it concerns about ticks, and Massachusetts has seen a dramatic rise in reported tick-borne diseases over the last 3 years, according to state data. This year, there's been a spike in one particular illness known as alpha-gal syndrome. That's hit Martha's Vineyard especially hard. The syndrome can cause food allergies triggered by eating red meat and some animal products. Sam Telford studies infectious disease at Tufts University, and when I spoke with him yesterday, I started by asking what he's seeing right now on the Cape and Islands.
I've been seeing Lone Star ticks on the Vineyard in Nantucket anyway, and my site on the Cape for 15, 20 years, but it's always been sporadic, 1 or 2 a year, and they go away the next year, and finally they've started to take hold. And so those sites, however, have had them long enough now so that there are good numbers to be found in hotspots. It's not as if, every single inch of the ground is covered with these ticks, but it would be very difficult to take a walk without becoming infested. But the other thing that we need to remember is that this is public awareness. A lot of people may have had alpha-gal allergy in the past and just passed it off as eating something that just didn't quite agree with them.
So should most people get tested? Would you say most people develop the allergy or not?
No, people should not just routinely ask for an alpha-gal test. It should only be done if there's suspicion that they have an illness compatible with alpha-gal disease. A recent study suggests down in the South that as many as 30% of the people that they tested have alpha-gal, and the proportion of those that reported illness was much, much less. I believe the study said something like 8%.
In the spring, Massachusetts health officials said they were going to require reporting on instances of alpha-gal. They don't have that data yet. That's expected later this summer. But I guess, what do you do to sort of maybe curb the spread, or is monitoring how you do this? What do you do?
I don't think monitoring would be very useful. And in fact, there isn't enough money in Massachusetts to do a proper job of it. In fact, what people should have the attitude of is there are ticks everywhere, right? Ticks could be in your backyard. And we're not just talking about Lone Star ticks. Deer ticks still exist. Lyme disease is still a huge problem. And so people should just assume that if they walk out to the compost pile or if they take a walk in a park near them, that they should take some simple precautions such as the use of repellent.
And so basically use repellent when you go out, other precautions that people should be aware of. And are there any different precautions people should take with alpha-gal that they may not be aware of?
Besides knowing that there could be ticks or mosquitoes out there, is if you feel sick, and, this includes fever, chills, muscle aches for things like Lyme disease, but also if you don't feel right after eating a meal of steak, then you should consider the possibility that you may develop an allergy and watch for it.
And if someone does get alpha-gal syndrome, what are the treatment options? I mean, do people recover? Do they go into remission? What happens?
There's not much that can be done. There are anti-allergy drugs that can be considered, but there's some people who have had alpha-gal who say it doesn't get better, but it doesn't get worse, and they live with it. For Lone Star ticks, there's nothing that can be done. You can't test the tick for anything. It's simply, be aware that you've been bitten and watch for signs of disease. And so just the fact that you've been exposed to a Lone Star tick does not mean you should worry that you're going to get alpha-gal disease. And certainly it's not worth going to the emergency room about.
That was Sam Telford, professor of infectious disease and global health at Tufts University.